This is Dr. Rebecca Grome. She's fantastic and is working here in Nashville at Ears for You. She is the owner and audiologist at the hearing services here in Nashville and is committed to supporting the hearing health of everyone, from preventing hearing loss to offering hearing health education, conservation, and recommending individualized solutions for every patient. She obtained her Bachelor's of Science from Miami University of Ohio and continued on to graduate with her clinical doctorate of audiology from the University of Cincinnati. After traveling the world while working for a hearing aid manufacturer, she decided to call Nashville her home and wound up purchasing Ears for You back in 2018, actually. Her second job, she says, is fetching snacks for her children. I love that. But she also enjoys spending time with her husband, baking bread, and my favorite part, silence, which is great. I love that. I love that in your bio. So welcome, and thank you so much for being here.
Yeah, thanks for having me. I'm
Yeah, this is
very excited
good. Good. I'm
to
glad.
have an audience.
Yes, yeah. So we got started a little bit here, and Dr. Grome and I had the chance to chat a little bit briefly after I actually went to her to get my hearing checked. And I'll talk about that in a second. But one of the things that I loved about you was that you were like so normal and down to earth and really just about like cutting to the chase and, figuring out how we can do these things and keep ourselves healthy. And that led us to having a coffee chat. And I thought, you know what? I like your mentality and I like the way that you think about the world, and that kind of aligns with what we do at New Roots. So I thought this would be perfect, and you so politely offered your time to be able to chat with us. So thank you for that.
You're welcome. It got me out of cooking dinner too, so
Yeah,
that's part of it.
I love that. Well, do me a favor, just tell us a little bit about your background and how you got into what you're doing and
Sure.
where you are today.
Yeah, no, I'm from Ohio, so that's probably where my bluntness comes from. But I went to undergrad for speech pathology and audiology, or some schools call it communication science disorders. And I got into that. My grandpa was a World War II vet and had a stroke, and he lost his speech. And so my goal was to go to school and be a speech therapist. That way I could help him talk. And I hated it. So I called my dad and I'm like, "Hey, Dad, I'm going to change my major." And he was like, "No, you're not." And he just hung up the phone. So I went audiology instead and graduated. Couldn't find a job in Cincinnati, which is where I was. So I don't know, I took the first job I could get, and it was a hearing aid manufacturer role. And I ended up loving it because I got to go into all these different practices and see who was doing great things and who was doing terrible things. And it was a really good education coming out of school where you really don't have any experience. Um, and I loved it. I worked on international projects. I was on a team with someone from China, me, and then a guy in Switzerland. And we looked at like buying trends and why people don't adopt hearing aids. So, I've been all over the place, but ultimately I bought this practice because I had two kids at home. And sometimes women have to put their professional careers in a back seat. So this was the easiest way for me not to do that. And I ended up right in the middle of Nashville, Tennessee, and I knew nothing about hearing conservation or musicians or anything like that. So I think the first week that I had my office, I had all these people coming in and asking questions, and I didn't know how to answer them. So I pretty much left the office for a month after buying it, and I spent a lot of time with Corey Portnoy in Colorado, and he's a guru with hearing conservation and musician-based um, audiology. And I really started connecting with some of the other audiologists, some of the in-ear monitor companies, and now that I can answer a lot of those questions, I get a lot of word of mouth business. It's something I never really thought about, but here I am, and this is what I do all day. So,
I
yeah.
love that.
Yeah.
Can you just, for those of us that don't know, can you just define a little bit about what audiology is? And I think we actually discussed this before. I have a minor in communication science and disorder. So I actually thought I was going to go down the speech pathology route up
Yeah.
until I was through grad school. And I thought I was going to do a lot more voice science. So that's where my background comes into play with the
Yeah.
voice science and the speech pathology. But I never went down the audiology track. And I don't know very much about the
Mm.
depths of what that is. Can you just explain to us briefly maybe what
Yeah.
it is and how that affects your
Yep.
day-to-day?
Yep. Audiology is technically anything hearing and balance related. So, the inside of your ear, half of it is your hearing nerve, and the other half is technically your vestibular nerve. It's the eighth nerve, and they're interconnected, and then they split. So, audiology can really be so many different things, same as speech pathology. You can do hearing aids, you can do testing, you can do surgical monitoring where, if they're taking out a brain tumor, we got to monitor those brain waves and make sure you're not getting into the language cortex. We can do tinnitus, we can do hearing conservation, testing in factories. I mean, people do mobile, it's wax removal. Now there's all this musician stuff. I mean, it can really vary.
Wow.
Some people are only into balance disorders. Some people are only into pediatrics. Yeah, there's a lot of different routes that you can go, but mainly anything with ear and balance.
See, I think
Yeah.
that's fascinating because, at least from my perspective, everything that I've always known as like audiology, it almost seems like it's for older people. It's like you need a hearing aid, you lost your hearing because you're getting old or something, right? But we don't think
Yeah.
about it as being sort of from the time that you're born and hearing to the time that you pass.
Yeah.
So you work with people at all ages, at all backgrounds, with all lifestyles, right?
Try not to see kids because I have my own and they're annoying.
Okay.
I hate to say it. I mean, they won't sit still, they're sneaky little things. So if I think my youngest patient that I see regularly is 8 and he's just adorable and I want him. So I want
That's
him to
good.
be mine. But
That's sweet.
no, usually it's like as long as you're in high school or older. But yeah, like for reference, you said I think of audiology as old people who need hearing aids. My average age for fitting hearing aids in this office is 52.
Wow.
So that's not old. And if that's old, then I'm getting old. I don't like that.
No.
But so yeah, I mean that stigma is kind of there, but I mean today or how about yesterday? Yesterday was Earwax Wednesday. I
Okay.
really don't think I saw probably 15 people, 15 patients yesterday, and maybe
Wow.
two of them were over 50. So,
Wow.
yeah.
Well, the way that we first got connected, actually, I went to you because I had a tinnitus flare up, which I'm regulating better now. I can say that I'm understanding a lot more about what that is and how to deal with it. And so I'll give everyone my perspective on what I was experiencing, and then Dr. Grome can give you the more official um, definition of what it is. So tinnitus, and you'll give the full definition, from my experience, was this ringing in my ears that I was getting from singing opera. And my background is in classical music. I sing multiple different genres. And typically, if I'm going to be singing, I'll sing in a microphone or something like that in a studio with headphones and so on. So I don't necessarily have to worry about singing loudly in a confined space. But I was preparing for an event that I was singing, and I kept singing in the car and in the shower and these really loud spaces and just basically singing at the top of my lungs. And so after a while, just kind of like going to a rock concert, I would be cupping my ear and trying to listen to the sounds I was making and just repeatedly sending really, really loud noise into my ear. Shortly after that, I got this experience where I started to hear this like buzzing and humming and stuff at a high frequency. I naturally freaked out a little bit, and I found a place in town that I thought would be really a good fit for musicians. And Dr. Grome's practice is exactly that. It's perfect. And I know that you service a lot of musicians. So you walked me through a variety of procedures to basically test to see what's happening and then also to see if I really do have hearing loss. And the good news is I actually do have pretty good hearing, but I just happen to have this buzz that still goes along with my hearing. So that was my experience. And Dr. Grome, I think you can kind of expand on what that is and how musicians can come across tinnitus.
Yeah, I think this is a slippery slope, and there's so much negative connotation floating around about how if you have tinnitus, you can't be a musician. And that's not true. That is not true. So tinnitus can be any phantom sound in your head that you can hear that no one else can hear. So for me, I have twinkling. It is like five different tones in there, and it's really loud and it's all the time, but it doesn't bug me. So I always tell people who come in with tinnitus is it's actually quite normal to have a perception of tinnitus. It's not okay to have a reaction to it. So when people come to me and they say, "Oh gosh, my stomach hurts and I can't sleep and my anxiety's through the roof and I started drinking, I started doing drugs because I can't get away from it." That's abnormal. A perception of internal head sound is actually very normal. So when people come to see me, there's always varying degrees of curiosity and trying to figure out what the root cause is. But the top two reasons people have ringing in their ears is noise exposure and stress, anxiety. And I think that encompasses most people nowadays. So, like Mark, I'm really glad for your case. And this is what I like to see is people come in, we go through kind of the methodology of what could be causing this and, do a diagnostic test and make sure there's not a real medical issue causing
Mm.
this, and then educate you on why it may be happening and things you can do to help alleviate the symptoms. And then usually people are okay with that. Do you agree with that's kind of how your process was?
Yeah, and you really helped me recognize that. So for me, when I was sleeping, like if I laid my head down on the pillow at night, I could hear that ringing and it was just so loud. And I think as musicians, we're really sensitive to that already. And you
Yeah.
even said this to me because I think in my test I showed a proclivity to hear high frequency sounds. And you were like, I think that's because you have your background in music and that you can hear those frequencies. So it
Yeah.
was very distracting to me. And for my ear, I'm so sensitive to all the different changes. But the one thing that was really a relief, one, I guess, if I can say this, is tinnitus can come and go in many cases. It can be
Yeah.
acute, it can be short term. And also, just because you have some other sensations in your ear doesn't necessarily mean that you can't hear. And what you and I discovered is that I actually can hear fairly well, even though I'm sensing these other sounds that are going along with my perception of hearing. And from what I understand, and this is maybe a little bit in the weeds for our conversation now, but um, I think it's very interesting. The way that our ear perceives sounds is with the little hairs
Mhm.
that receive the signal and then translates it into the nerve, I guess.
Yep.
So at some point, those hairs will not function properly and not be able to pick up certain frequencies. And then that is your body responding to those frequencies, creating a pitch. Is that the case?
Correct. Most of the time, even if it's not showing up on a hearing test, our body degrades as we age. And so, especially people with noise exposure, or if you have other medical conditions, high blood pressure, if you're diabetic, anything cardiovascular, really, there can be damage to those hair cells that it's not evident in the booth. And so when there's damage there, there's not as robust of a sound going to the brain. The brain's not getting the stimulus that it's expecting. And so what happens is it just starts to fire spontaneously, and then it gets louder and it gets louder and it gets louder. And then you're stressed out about something else. And next thing your brain is like, oh gosh, I'm dying. I have a brain tumor. So it's just it goes in that mode where you just start to kind of freak out a little bit. And that's your limbic system. That's what it's for. It's to keep you alive and to keep you aware. So yeah, essentially what happens is there's just damage there and it's not getting the response at once. And so it just makes up its own signal. Um, and then usually, if you hear ringing, it's here. It's in the back of your mind. You notice it, but it doesn't really bother you. But when you think about it, you can literally move that sound from the back of your head right here to it being so loud. And that's your perception. That's part of, again, how your brain works. It's funny. If you think about something, you can make it louder. So, mhm.
Wow. That's fascinating. I guess I never understood the idea of being able to focus on it. Like one of the things that you told me, which I thought was fascinating, and I'm going to move on from tinnitus here, but I just think it's an interesting case because as musicians, we do come across this very frequently. But one of the things you told me was to listen to music, to sort of disguise the sounds that I'm hearing and then start to lower the volume. And as you start to do that, it kind of eases your brain and eases, it's like warming up and cooling down almost, it seems like. If you
Hmm.
do ever have loud exposure to sound, that was, or tinnitus, acute tinnitus, you can kind of deal with it that way. I do have a follow-up question too around this subject. So, as musicians, we're surrounded by noise and sound all the time, whether we're at a
Yeah.
in a band singing on a stage, or we're in the studio or whatever it is, and we're exposed to noise and sound. Do you have any advice for professional musicians and people that need to protect our ears? Do you have any advice for things to look out for, or things to do or not to do, to conserve our ears and also still allow us to, one, have a good time, but also use our ears the way we need to?
Yeah. And I think you made a good point there, to have a good time, because I have some patients who've just gone off the deep end with monitoring everything. And it's like, okay, we still have to live our life, and you still have to, put passion into your work. You can't sit there and be fussing about it all the time. So I think, rule of thumb, of course, is if you're around a lot of noise, you need to wear hearing protection. Foam earplugs are not the best, but they're better than nothing. And, they will fit in your purse or in your pocket. So use earplugs when you're at a concert or anything like that. I think the easiest way also to just kind of monitor your surroundings. My favorite app on my phone is the NIOSH app. It's NIOSH. And NIOSH does all of the research for safe listening levels and how long you can be in certain sounds before you're at risk of damaging your hearing. In the app, you can just get a snippet of a sound clip of what your environment is, and then you can just get a gauge. So I know that when I go to the studio and I'm playing with this band, this is my average listening level. And then they have a chart on there where you can go back and compare. And you can say, okay, I was in the studio for 6 hours at this dB level. I'm safe. I'm good. Or, yeah, I was kind of on the cusp, or I left this situation and my ears were ringing. That's a sign that you had overexposure. So one is listen to your body. I know I hate it when my doctors say that, listen to your body and you'll be fine. But really, if your ears ring after exposure, it's overexposure, number one. Second thing, don't freak out about it, but just educate yourself and monitor it. And that way you kind of know, from a third party scenario, how long you can be in that environment and feel comfortable that you're not doing long-term damage.
That's great advice. I was going to say, is there like a metric for that? Because I
Yeah,
know obviously when it's louder, and I don't know if you have this information on hand, but when it's louder volume, you can only take it for a certain period of time. When it's a little bit quieter, then you can withstand that for a while. But the figures are actually pretty interesting. I don't know if
yeah.
you know them offhand, but
So the less conservative rule of thumb, is, you start at 85 dB. And this is all for workplace exposure. Unfortunately, the music industry acts like OSHA is not a thing. Um, I will look up an Android device, an Android app. I will get to that. Um, you're right. The NIOSH one is only Apple. I'm sorry. So it's easy math for us non-math people. So if you're 85 dB, you can work in a factory at 85 dB for 8 hours a day. If you add 5 dB, so you're at 90 dB, you cut your time in half. So now you're at 4 hours. 95 dB, 2 hours, 100 dB, 1 hour. So
wow.
yeah, so you can do math, and that's a non-conservative metric, but it's easy to remember. So I'm okay with, yeah. I mean,
Yeah.
the other thing too is everyone should have a baseline hearing test if they're in this industry. I am a huge proponent of validated and verified fit of in-ear monitors. I think a lot of people view in-ear monitors as hearing protection, and they can be, but they can also have a very, very high output, which is even higher than some of the hearing aids that I fit. So I think that's just a really common misconception in this field is we're getting this to protect our hearing when really you're just blowing yourself out.
Sure.
So that's a slippery slope as well. And I think that needs to be talked about more. So,
Totally. And one of the things that we like to discuss at New Roots is building your community and building your team. And we forget about these little things until you really need them. You know, it's like a good tour manager, you know, et cetera. An ENT, I always talk about an ears, nose, and throat doctor for your voice. You always want to have one of those on hand. And an audiologist is actually another um, specialist that you want on your team to be able to say, hey, I can get my in-ears fitted properly. I have another quick question for you, Dr. Grome. What do you have any recommendations of this NIOSH app looks awesome, by the way. Recommendations on attenuating earbuds. So if you're taking it a step up from those foam earbuds, do you have any other like earbuds that are noise cancellation or attenuating that you would think you would recommend or are pretty good?
I always recommend like custom fitted filtered earplugs.
Okay.
So you can, most brands are selling them. I tend to prefer Sensaphonics. Microsonics has some. You know, if you're getting in-ear monitors, most of your in-ear monitor brands will also have a option for a filtered earplug. I want it to be silicone, not acrylic. Silicone is the soft material, acrylic is a hard material. And again, I like the custom ones because when you come into my office and do your hearing test, and then you get your product and we get your filtered earplug, I can redo your hearing test with your earplug in, and that way we know exactly how much attenuation you're getting. So, just for round numbers, custom filtered earplugs in my office are around $350. If that's not within your budget, that's fine. You already should be coming in for your hearing test, Eargasm, Ear Pro, ear erasers. They're all on Amazon for under 20 bucks. Go ahead and find something that you find to feel comfortable in your ear. And then same thing, come on in here and we'll rerun your hearing test with those in. And that way, again, you know exactly how much noise reduction you're getting based on how it fits in your ear. So we can do that with any product that is brought in.
That's great. I didn't even know about that. I may have to see you for those too, just to see.
Mhm.
Another thing here, talking about numbers, unfortunately, in the music industry, everything is about the finances of it, you know. But one of the things that you and I discussed is that seeing an audiologist and going through these procedures and testing things out are really not, it's not that expensive. And I just wanted to know if you can give us a ballpark of like, okay, you're a professional musician, you're going through these things. What resources are available for you to get your hearing tested or get some in-ears or something? You know, what would that look like and how easy is it to get it done?
Yeah. So if I could wave my magic wand, my protocol for musicians on a baseline hearing test would be a very extensive diagnostic test, which would be otoacoustic emissions, measuring the hair cells to look for pre-damage,
Hmm.
and then doing a pure tone, press the button when you hear the beep, all the way out to 20,000 hertz. If I could knock that out on everyone before they get started, that would be amazing. And then annually, I would do just the pure tone testing. So for reference, my appointment where someone comes in and just does the pure tone testing through 20,000 hertz, that's a $125 test. If everything's normal, I schedule you for 2 years out. If everything's not normal, meaning you have damage or you have a complaint of cannot hear in background noise, hyperacusis, which is sensitivity to loud sounds, or you have tinnitus, then I put you on an annual recall. Um, Good things are insurance will cover a very small portion of that test. The reason for that is insurance is really only identifying a standard test battery out to 8,000 hertz. And I like to test out to 20 because y'all have noise exposure. Noise exposure a lot of times is hidden below 8,000 hertz, so we don't find it right away.
Hmm.
Um, So things get a little bit more expensive when someone comes to me with a problem. You come in my door and you already have the noise exposure, you already have the tinnitus. We're trying to find the root cause. We have to do a more diagnostic test, and that can round up, I would say, anywhere $350 to get all of that knocked out to begin. But again, maintenance long term, now that we've done the education portion, 150 bucks a year just to monitor that, or every other year. I'd
Yeah.
say most women in particular tend to have better hearing than men. They take care of it better. They're more sensitive. So most of my women musicians are coming in about every other year um, for that testing. So divide it out, $75 every year just to
Yeah.
monitor things and make sure it's good to go.
Yeah. And it's super reasonable too. I did both of those tests when I went in, and it was obviously painless. It's not even invasive at all. But the biggest thing that I got out of it personally, and what I want to pass along to everyone who's listening, I this year I took my professional music to the next level. I just said, you know what, I'm really going to be serious about my artistry, about my body's health, and I just wanted a good baseline in addition to checking out my hearing. So the good news is, and this is something Dr. Grome I'd love for you to comment on. The good news is we now have a baseline for what my ears look, feel, sound like. And God forbid I experience anything on tour or in the next few years, as I'm going through all of the things I'm personally going to be exploring musically, I have the ability to jump on it early. And
Yeah.
so, something that you want to consider as you are a professional musician and going about your career is that I know Brooklyn, I don't know if she's in here, but Brooklyn and I talk very intimately about her aspirations to tour around the world and to be, a singer that performs in stadiums. And so that talk about, there she is, talk about noise exposure, so
Yeah.
having the ability to get a baseline and say, okay, this is when you're, this old at this point in your life before tour, here's what you're like after tour and whatnot. So that's just maybe a grander kind of big picture idea on ma maintenance and making sure that you're staying as healthy as you possibly can.
Yeah.
So,
And my recommendation on that is, and I have this conversation a lot with musicians, um, a pre and post. Brooklyn, I swear, I hope I see you in some major arena someday. But I hope that you get your hearing tested before and then after. Because I have a lot of musicians who they get their new in-ears, new brand, new fit right before they go out. They have 2 days to rehearse with them, and they get like halfway out on tour, and then they're like, "Oh, my ears are ringing." Well, every product is going to sound different. And then, if you're playing on Broadway versus playing in a stadium, we need to know that before you pick out said product because there's some nuance differences there too. And I personally am a dealer for a lot of the in-ear monitor brands, but I will be the first to say I think a lot of it is malarkey and marketing. And there needs to be more education about matching up the need of the musician with the product in particular, and then that validation measurement as well.
that's huge. A
Yeah.
lot of the artists that actually are in this room right now are developing and just at the cusp of really opening up their career. Do you have any advice for them from your perspective on, things to look out for or good practices to stay healthy? A lot of them are probably performing out live writers rounds. They're doing a lot of sessions. They're doing all those kinds of things. Is there any general advice, maybe things that you see with the artists coming through your practice? Any of those?
Non-audiology advice or either?
Let's hear both. I'm curious.
I every day I giggle with my front desk, Bryn. Have you met Bryn? Maybe not.
Not yet. No.
Her husband is a touring musician. She's one of the dealers for a different in-ear monitor brand. We giggle at the people that y'all surround yourself with. Musicians are like herding cats. So you need to find a team of people who are going to roll out the red carpet for you because you deserve it. And you're going to be busy and you're going to need protection and you're going to need people to be looking out for you. So I'm sorry, don't hire your best friend who is a hot mess to be your handler. It's not worth it. They're dragging you down and they embarrass you when you are not in the room. So it's funny. I see that a lot. I have one artist in particular. She left my office recently, and I was like, man, how do I hire her team? Because her team was like, da, 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 and everything was organized, and they made sure that nothing was happening to her that wasn't supposed to happen. So I'd say from a non-audiology side of things, a team is very important. And finding a team of people who you trust and who are going to stand up for you and deal with your crap, because you really need someone like that in this industry.
I love it.
Yeah.
That's awesome. That's something that we preach at New Roots. And forgive me, I actually forgot to talk a little bit about what we do at New Roots, but maybe we can wrap up with that here at the end. But I think that's so important. And Sheridan and I really try to share this with the artists that come through our program. Your team is the people that you surround yourself with are the ones that you're going to elevate with, and it's so important to build that community. And here at New Roots, no, but at New Roots, we really do. We try to talk about that and emphasize that because, like you said, I mean, having the resources and having the network of people that can support you and those that you can turn to for information. I think many of you here in this chat, in fact, I should ask this question. How many of you have actually seen an audiologist and gotten your hearing tested? I'm going to take a random guess with no professional background knowledge. I think probably one or two people here has ever done that. And that's okay. I think my recommendation is you probably should like tomorrow. But the information in the community that we're building and what we're trying to do here is to be able to give you these resources so that when you do come across this, or maybe you think about, hey, maybe I should look into this or take this more seriously, that it's there for you. So that's what we're trying to do with these programs. And one of the reasons why we brought Dr. Grome here to continue these conversations. I have another question for you. It's a bit of a bizarre one, but I'm really interested, and I think we might want to wrap up along these lines. So I'm curious, you've been doing this for a little while. You've had a lot of people come through your practice. Musician or not, what is the most unique thing that you've experienced, or something you've seen in someone's ear or whatever it is? What is the most unique circumstance that you
Ugh,
experience in your practice?
unique or gross?
Let's I don't know. Let's maybe not do too gross, but something that startled you, something that
Um,
caught you off guard. I'm very interested.
I I thought this was quite funny. I have a factory that I go to and I do their annual testing offsite. And I've been doing this factory for a while, and there's a younger guy there, and he always has something in his ear and it's white. And he said that his sister hit him with a toy when he was growing up, and he's always had something in his ear. Well, I can't see around it, but his hearing's normal, da 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 da. Well, I just saw him and I was like, man, you got a bunch of wax in there. I can't even see this little white thing anymore. Like, what is it? It was a Barbie shoe. He's had a Barbie shoe in his ear for probably 20 years. I finally got it out. He let me pull that sucker out of there.
Get out of here.
It was a white Barbie shoe.
That's
Hmm.
insane.
Yeah. It was entertaining.
Yeah, to say the least. Can you
Did he,
imagine?
did he feel immediate release and like could he hear so much better from that?
He already had normal hearing. It was just wedged in there and it wasn't against his eardrum. It was just in his ear canal. I could just see
The
like the
heel.
tip of the heel,
Oh
the
my God.
stiletto. And so it brought out a bunch of wax this time, so he was relieved, but he didn't notice any difference in his hearing or anything. But we got a
Wow.
big laugh out of that one. I wish that was one that I got on like video for
I know you
TikTok
should have filmed
purposes.
it.
I
Gosh,
know everyone's like, you need to have, stuff on a TikTok channel. And I'm like, I only have two hands and I'm inappropriate 90% of the time. So I should like publicly display how awkward I am.
that's funny. Can you imagine if you got that on video? That would go viral for sure.
Oh,
That's
yeah,
disgusting. Thanks for
yeah,
sharing that. That's what I was looking for. I was looking for that little nugget there. That's really what I was going for. Thank you.
yeah.
Well,
I,
I think we have some time for some questions. I'd love to open up um, the chat here. And so for any of you that have questions, Dr. Grome, thank you so much for taking the time to chat with us and share your wisdom. I'm sure we'll have a lot more to talk about in the future too. But anybody that has any questions for Dr. Grome, I'd love to have us answer your questions here.
I have a question.
Yeah.
Uh, for so I see this a lot with artists that are not they don't have custom in-ear monitors yet. And a lot of the stages around Nashville, you're just using monitor wedges to be able to hear. And especially if it's in a loud room, then the monitors just keep getting cranked louder and louder, and the artists are just fighting constantly with the room noise and hearing themselves. And what are some best practices with regards to those types of monitors? And I've had artists that try to have a at least just a earplug, like a custom earplug in there, but then they can't hear themselves as well, and so they're constantly battling with how to have ear safety, hearing safety on stage, but while also still being able to hear themselves. Do you have any advice for that?
yeah, and that's individual per person. I have this conversation like once a day, and it's really like, okay, what bar are you at? What instrument do you play? How long is your gig? What is your NIOSH listening level? What are your goals? Are you able to play without this crowd noise? Are you needing to hear yourself more? We have a lot of those discovery questions because some people really don't want any external noise, and some people want a filter. It just really depends. So, someone on Broadway, a lot of times what we'll do, we we'll take like a universal set of like $200 Shure in-ear monitors, and I can make a custom silicone sleeve for that to make it fit in the ear like a true in-ear. And then we'll put an ambient port in there. That way they get a little external, like it's a hard question to answer because it really is just dependent on the person. But I try to have most people down on Broadway. I've got them on like a filtered earplug, or same thing like an Eargasm, a Ear Pro, some filtered non-custom earplug. That way they can hear, but they're not isolated. Does that
Right.
make sense?
Yeah. And I recently got a pair of the custom filtered earplugs.
Yeah.
Holy crap, the difference is insane, you guys. And I will
Girl,
say, like,
come see me. What are you
I know,
doing?
well, they were free at a conference I went to, and so I just took advantage of that opportunity. But I do need to come
You
see you to
should,
get my hearing
as you
checked.
should. Yeah. Free is always better.
I couldn't
Well,
resist.
not always, but
Uh, yeah, but it really has changed the game for me because having that filter, I can hear what's going on. I can hear all the instrumentations. I can hear the voice on stage.
yeah,
It doesn't hurt. So I
yeah,
really encourage you all just to please go get them.
yeah.
Uh,
And there's different filtering. Like I said, my preferred brand uses like the standard Etymotic filter, and Etymotic is who did all the research for filtered earplugs. And so you can get a 9, a 15, or a 25 dB reduction. Some of the other brands have different reduction ratings, and their filtering is a little bit different. So again, depending on your environment, I, as your professional, will then make a recommendation for how much filtering you need. And I always tell people, if you get these and you just don't like how isolated you feel, just bring them back in. We'll switch the filters out because you can get more than one set of filter. And then, if you're at Bridgestone, you wear this filter. If you're at Honky Tonk, you're in this filter. If you're at the Ryman, uh, maybe nothing. So it
right.
just really depends on what they're doing day to day and what their goals are. But yeah, I mean, that's a really common conversation that I have. So.
That's a great question. We have a couple more that came through that are really good. I'm going to try and make sure we can address them quickly here. But so Brooklyn was asking about listening to music loudly. Is there a way to listen to music loudly but safely? And Brooklyn, I think I understand what you're talking about because we've discussed this before. there's a certain threshold when you're listening to music where it just feels so much better, where you feel like surrounded by the music and just enveloped in it. And in order to get to that point, you probably do have to listen to it pretty loudly, but there's probably a safety, maybe not 95% of max volume, but maybe it's more like 75 or 80% in your headphones, whatever that is. Do you have any advice on that, how to listen to music and get a really good experience, maybe feeling involved with the music or a part of it without causing any potential issues?
We talking about through headphones or just through
I,
speakers in the
I'm going to
ear?
suspect, Brooklyn, you're talking about through headphones. Can you just clarify if you don't mind? If you're able to, I know you're running around here. Yeah,
Okay.
headphones.
Well, so there's different things to think about here. So if you're wearing an AirPod that is not going to fit 90% of you women here, there's noise reduction, and then you have your volume. You can get the perception of volume because your noise cancellation is on, depending on how it sits in your ear. So I love over the ear muffs, like cans, just because to me they sound more full and more bright. And they're going to sound more full because you don't have acoustic leakage from it not fitting well. So you might have to experiment a little bit with your headphone. I think it's completely achievable to keep your noise levels down, but feel it. And the goal would be to isolate that sound in your ear as much as possible. So that's why in-ear monitors, people like the sound of them because it's a seal in the ear and there's no low frequency leakage. Over the ear muffs, same thing. I personally don't like muffs because it leaves a thing in my head right there and it messes my hair up. But you're not going to find it with an earbud, because our ear canals are too small and it's going to hurt for you to get a seal in a non-custom product.
Yeah, that's great because I think for us, we have to realize that if that seal is not there, if we're not stopping the sound around us, the sound that we're trying to get out of our headphones or earbuds is competing with the other noise around us. So we
Correct.
have to turn it up louder for us to hear it. And so we're fighting the noise in the room. And as we're doing that, we have to turn up the headphones even more. And it's this sort of bad cycle of doing that. Whereas, as you're saying, if you have the noise cancellation, then you can stop the perception of the sound around your room and keep the volume at a listening level that still gives you that nice experience, but
Yeah,
doesn't overwhelm your ears.
correct. And it's strictly an acoustic thing. Most people associate low frequency with volume and high frequency with clarity. So if your goals are to listen louder so you get a fullness, then you need to find something that covers your whole ear or occludes your entire ear canal. That way you don't have low frequency leakage. Yes. Yep, absolutely. So, if your goals are to get more clarity, meaning more treble, then you can wear something less fitty, like less custom, because you're really going to get more of a high frequency response out of those headphones.
That's great. Really great. We have another question here about the normal decline in hearing, and I think you touched on this briefly. The question is, does your hearing decline normally as you age, and it's not related to any particular damage? Can you just speak on that briefly?
Yeah, there's actually an age chart that we can go by per if you're male or female on normal progression due to age. And that takes into consideration your genetics, your overall general health. Like I said, blood pressure is a huge one. So anyone with any sort of cardiovascular disorder,
Mhm.
yes, there's a normal progression and you can protect your hearing all that you want, but if you genetically are predisposed to hearing loss or you end up with cancer and you need chemotherapy or radiation, I mean, that's going to override it. So,
Yeah.
not to get dark on it, but I
Yeah.
mean, again, I think it's also what we were saying before is you still need to live your life and do your thing and enjoy it. But yeah, there is going to be a normal progression. I bought my office in 2018, but the previous owner had it for 40 years. I have some patients that I literally have 45 years of hearing tests, hasn't changed. And then I have younger people, older people where I have to test them every single year and I'm on them because their hearing changes.
Wow.
So,
Is it, I have a question. Is it linear if you are just aging and your hearing loss you're getting increased hearing loss? Is it linear in the sense that your higher frequency of hearing abilities will slowly decrease and you'll just go from you're hearing at 20 to 18 to 10 to whatever? Is that how that would work, or is it just sort of ambiguous?
it's ambiguous.
Okay.
When you have hearing loss due to life, age, I don't like the word age. When you have hearing loss due to life, typically it looks normal in the lower frequencies and then it trails off in the higher frequencies.
Hmm.
Um, Other medical conditions cause different types of hearing loss. So if you have Meniere's, that's low frequency. If you have um, noise induced hearing loss, it's going to look different. So it's going to progress differently. Yeah.
That's great. And
Yeah. So it's really just dependent on usually what's the root cause going on there. So,
And the good news is the sounds that we need to listen to throughout the rest of our life, both the speech level sounds and any sounds we're going to hear in music, all fit within that healthy diagram. So even as your hearing is aging, most of the time you probably don't even notice it unless it's a more extreme case. You may
yeah.
lose some of the like very, very high frequency stuff, normally. And then the good news is as long as you're keeping up with your health, your hearing health and everything is pretty good, you're still going to be able to hear all of the things you need to hear musically.
Correct.
Yeah. We have another great question. So we have a classical singer in the room. Megan, this is a great question. Thank you for joining us, by the way. I think you're a Belmont student, right? Awesome. Thank you so much for being here and great question. So I want to make a quick comment on this. So she's asking, for those of us classical musicians, we rarely have in-ear monitors. And she's asking if you could talk about the difference between musicians' earplugs and the in-ear noise reducing earplugs. So actually, one thing I want to mention, Megan, as classical singers, part of the reason why we sing um, adjusted from one another. We don't sing near each other's ears. Even if we're facing out, we don't sing in each other's ears. So you can actually rupture your partner's eardrum by singing next to them. In fact, one of my colleagues had her eardrums ruptured twice because her husband was a baritone and they were doing love scenes and they're holding each other and he was singing directly into her ears.
Ugh.
And both times had her eardrums ruptured. So that's a proximity thing that we have to actually work on as classical singers as well, because we have to be aware of what we're doing for our scene partner too. But Dr. Grome, if you wouldn't mind commenting on that, the difference between musicians' earplugs and the in-ear noise reducing earplugs as it relates to classical singers.
I'm sorry, I need clarification. Are you talking about like filtered earplugs versus an in-ear monitor?
Megan, you can
Yeah,
both, yeah.
I'm
Okay,
just not really sure what the difference is between like an in-ear monitor and
sure.
musicians' earplugs.
So musician earplug is going to not have any feed. It's not going to have a sound feed in your ear. An in-ear monitor is the product that you wear where you have an audio engineer or a monitor engineer who's giving you a click track or a melody to sing along with. So filtered earplugs are strictly hearing protection with no sound. In-ear monitors are headphones with a feed in them.
So realistically, Megan, if you were doing like a crossover gig and rather than having a symphony behind you, you had a big band with drums, electric guitars, and they all have speakers. If you were to be singing and trying to compete with that noise, it would be so overwhelming for you acoustically. You would probably need to have in-ear monitors to accommodate for that with the music that you're singing.
There's actually a very good research article. I just wrote it down. I'm gonna have to find it. It's Marshall Chaston is out of Canada, and he does a lot of research on musicians with hearing loss. And I remember reading an article once where he rated who's most who's at highest risk of hearing loss
Oh,
based on musical category, and it is classical singers.
no way.
It is, yeah, and it's and I know
Wow.
that because I work at the symphony here, and they're struggling. They are
Yeah.
just bombarded with very loud music. And
And
they're
it's the
on top of each
proximity of it.
other,
Yeah.
it's close proximity, and
Mhm.
yeah, they have all those those plastic dividers up, but it's a mess.
Yeah.
So
I never would have thought of that. There's something comparable with voice pathology. There's sort of an asterisk at the end. It's like who is at the risk the most for vocal issues.
Yeah.
And ironically, country singers are the lowest. They're like the least at
Oh,
risk, but
they
then
don't
there's an
sing.
asterisk and it says, but most likely they're just not going to get their voices checked. That's what the research says. Because, you know, it will affect all of us, whether we're over singing or listening to music too loudly. If it's classical music or rock music, it's the proximity, the time, the loudness, all those things is going to affect all
Yeah.
of us. So even more so the reason why we need to be paying attention to it. So well, thank you. I think that's all the time that we have this evening, but Dr. Grome, I appreciate you very much. And everyone who was here and listened to us, I think most of you are familiar faces. Megan, I think you're a new face, and Kara, thank you so much for joining. I briefly, Rebecca's going to say one more thing, and then I'm going to just pass it over to Sheridan to close things out for us.
Oh, what do I get to
Yeah.
say?
Oh, sorry. Yeah.
You want me to talk about how I think everyone should get their
Yeah,
hearing
sorry.
tested? Yeah.
Let me give you a better leading question for that. You're going to say one more thing and go anything. No. What I meant to say was thank you for your time, and
Thank
also what is the best way that we can connect with you in your practice? And I think there was something you wanted to just leave us with.
Yeah, no, I was gonna say I'm gonna go through the rest of these like chat questions, and I would love to just send out like an email with from my personal email, and that way you have a contact. But I would highly encourage everyone to go out there and find a local provider wherever you are. I can definitely find someone for you who specializes in musician patients, and get your baseline hearing test and just be educated about kind of your needs, your individual needs as a musician. So that Mark just put my website up. You can definitely go there, but I'm going to get something out to y'all tomorrow for participating and hopefully answer some of those questions. And then you're more than welcome to just keep a dialogue going with me based on what you need. So
That's fantastic. Wonderful. Well, thank you. I appreciate that very much. We're grateful for your time.
thanks. Thanks for having me.
Yeah, thank you so much, Dr. Grome. That was super, super helpful, and definitely going to be making an appointment soon. So thank you for inspiring us to take care of our bodies, because without taking care of these precious things, we have no careers. So appreciate you very much. And most of you on this call are familiar with New Roots, but we just wanted to remind you all that applications are open for just a very short amount of time for our next Nashville Weekend Intensive that we have coming up the first weekend in April. It's going to be epically amazing. Some of you are already alumni of our program on this call, but we are opening up a couple more slots for artists to come join us at Airbnb for 4 nights, 3 days in Nashville. And we're going to have some incredible guest industry speakers to come and educate and inspire you in all different parts of the music industry. You'll get to record a song with a producer. We'll have a writer's night at the end of the weekend. You'll get a photo shoot. But most importantly, you're going to leave with a lot of new friends, new knowledge, and a community that you can lean on for support, most importantly, as you go forward on this this amazing career choice of being a full-time musician. So we will also include more information in a follow-up with you all, but if you have any questions, please don't hesitate to email us, info@wearenewroots.com. Mark and myself both will be monitoring that inbox, and just please update us. For those of you that we do know here and have a history with, please let us know what you're up to. We'd love to feature you in our newsletters that we have coming out, and champion you as always. So please keep in touch, and thank you all so much for being here. Mark, thank you for taking the lead and doing this wonderful interview. Super,
So fun.
super helpful.
Super fun.
Yeah, so you all enjoy your evening. And is there anything else that I forgot, Mark?
I don't think so. I think you nailed the pitch and everything. It's been great. This is so fun. We're hoping to do more of these things in the future. So encourage your friends. This stuff is not just for New Roots friends. It's from friends and family and everybody tangent to us. So if you've come through our program, great. Go tell other artists that could benefit, and we're hoping to do more of these in the future. So be on the lookout for that.
Yeah, and if you have suggestions for other topics that you'd like to learn about, please let us know. That'd be super helpful. All right, everybody.
Awesome.
Well, have a wonderful evening, and thanks again.
Thank you. Take
Thank you,
care. Have a good
guys.
night.